So you've taken a Zoloft, you've taken a Lexapro, you've taken a Prozac, you've taken a Wellbutrin, you've been there, you've done that. And it's like, it worked for a little while, a year, 2 years, then it stopped working. We increased the dose, then it stopped working. Before you know it, 8 years went by and I cycled through 6 different medications. That would be a perfect candidate for something like this, for TMS, Transcranial Magnetic Stimulation. So I have a lot of patients who are starting to come in and ask about alternative treatment. Sheila, what else could I do? What if I don't want to do meds? I've tried everything. Like, there's got to be something else. And there is. There's TMS. And TMS is not new. TMS stands for Transcranial Magnetic Stimulation. And like I said, it's a technology that's been around for 70 plus years, and they've just continued to build upon it and improve and get better. The more we start to learn about the technology, the more we start to learn about the human body and the brain and just how things interact and react and so on and so forth. They've been able to get better and better with the technology. So essentially what TMS is, no matter what the machine is that you use. So that's one question that I'll get from patients, like, well, what's the best machine to use? Most of the machines use the exact same technology, which is magnetic stimulation. It's in the title, TMS, Transcranial Magnetic Stimulation. So they all use magnets to help stimulate the cells in the brain. So it doesn't really matter what machine you use. Different machines have different bells and whistles, and those bells and whistles usually aren't what affect the effectiveness of the procedure or the treatment. Those bells and whistles are usually for us as the providers to kind of make it a little easier for us to set the patients up, get them comfortable, locate the different anatomy of the brain so that we can make sure that we're in the right location that we want to treat. But all of those bells and whistles, for the most part, don't change how effective it's going to be for the patient. So if you're looking into TMS and you have a provider that you're seeing or you know of somewhere that has a TMS machine, feel free to go in and ask questions about it, go see the machine. Here at Augustin Psychiatric right now, we're using NeuroStar TMS machine. It's one of the most popular. We have the newest model that just came out. I believe it launched possibly either January or February of 2025. And currently right now we're in April of 2025. So it's 2024, February of 2024. And we're now in April of 2025. So it's about a year old. So it's pretty new. It's their newest machine. Technology is pretty much still the same. Like I said, a couple additional bells and whistles that I myself as the provider appreciate, being able to connect to Wi-Fi so that I can send information from the machine back and forth to my EHR and things like that. Those aren't the things that patients are really worried about. They just want to know, does it work? Does it hurt? How much does it cost? Is it safe? Will my insurance cover it? So let's go through all of that. So most TMS machines are FDA approved for the treatment of treatment-resistant depression. And in the psychiatric industry, what we consider treatment-resistant depression is anybody who's been dealing with depression and has had a failure of 2 or more medications, antidepressants usually. So you've taken a Zoloft, you've taken a Lexapro, you've taken a Prozac, you've taken a Wellbutrin, you've been there, you've done that. And it's like, it worked for a little while, a year, 2 years, then it stopped working. We increased the dose, then it stopped working. Before you know it, 8 years went by and I cycled through 6 different medications. That would be a perfect candidate for something like this, for TMS, Transcranial Magnetic Stimulation. Does it hurt? No, it doesn't hurt. We use magnets in so many different areas of our lives that we forget it. We have magnets in our phones. We have magnets I think we have magnets in microwaves. I'm sure somebody will correct me if I'm wrong, if that's not correct. But there's so many different places in our lives where we use magnets and we don't even know. It doesn't hurt. So what they'll do is they'll place the machine on the part of the brain, on the part of the head that we want to treat. And what you usually hear is a tapping within the machine. It's not very loud. It's something that if patients want to wear earphones, or if they want to wear ear protective equipment, they can, but it's really not necessary. I would say 100% of my patients that I've ever treated with TMS have never used the ear protective wear. So it doesn't hurt. It's FDA approved. It is covered by insurance. However, it's FDA approved for the treatment of major depressive disorder, and it is covered by insurances currently for major depressive disorder. However, TMS, we have hundreds upon hundreds upon hundreds upon hundreds of studies that show that TMS has also been effective for anxiety, eating disorders, OCD, which is obsessive compulsive disorder, insomnia. There's so many other things that TMS has been found to be very effective for. Although they are not FDA approved yet, there is enough data that we know as providers that this works. So the best way I can kind of explain this is almost like, it's almost like Benadryl. We know what Benadryl is used for, right? Most people usually use Benadryl for exactly what Benadryl should be used for. But along the way, we've learned that, like, you know what? We realize that, like, when you take Benadryl, you get really sleepy. So if there's ever a time where it's like you have a little bit of insomnia, take a little Benadryl and you'll be able to go to sleep. So that's an example of something that it has an actual indication. However, we found that it can also be used for some other things as well. So it's the same thing with TMS. It's not that those other indications are not safe. They are, they're perfectly safe. It's just that the FDA has not approved certain machines for them to be able to do that, which is okay. They can still safely be used for other conditions. So we've already covered, is it covered by insurance? Yes, by most commercial and even Medicaid and Medicare, TMS is usually covered. Of course, you'll have to look into your specific plans. There's different carve-out plans that have different specificities and so on and so forth. But generally, TMS is covered by most commercial insurances as well as Medicaid and Medicare, depending on the state. Does it hurt? No. What is it used for treatment? It uses magnets. Who is it appropriate for? It is appropriate for, if you're going through insurance, it's appropriate for people who have treatment-resistant depression. If you decide that, listen, I don't want to go through insurance, I want to just pay for this myself, I want to be able to sit with my provider and we decide how we want to tailor my treatment and what I want to use the machine for, then that opens the door for you to be able to use it to treat OCD, smoking, eating disorder, insomnia. Pain is another really, really, really big one. And again, these are safe uses that we have hundreds and hundreds and hundreds of studies for. Although TMS is starting to build some traction now with a lot of patients learning about it, it's not new. It's not new at all whatsoever. It's been around, and it's not just here in the US. You can go to up to 80 other countries that also use TMS, including Canada, including the entire continent of Africa. You can go to a lot of other countries and they're using TMS technology. So it's safe, it's well studied, it's covered by most insurances, or you can go the cash route as well. It really just depends on what your preference is and what you really want to treat. So one of the other things that a lot of patients want to know is, all right, how long does it take each session? How many sessions do I have to do? So typically with most TMS machines, you're looking at anywhere between 10 to 20, 25 minutes per session, and you're looking at about 30 to 36 sessions. And that could be dependent on the machine, that could be dependent on the protocol, but that's about average. For the NeuroStar that I'm currently using here at Augustin Psychiatric Associates, It's 36 treatments, and each treatment is about 18 to 22 minutes. It varies slightly by patient, right? Anatomically, we're all the same on the outside, but we're all specific, human beings. And this is a very intricate piece of technology, and we really tailor the treatments to each patient. So that's why you'll see those variations often. 18. Well, what's the difference between the 18-minute treatment and the 22-minute treatment? Is the person who's getting a 22-minute treatment getting more treatment, getting better treatment? Does that mean they're getting better faster? No, not necessarily. It's just different treatment protocol, different treatment length based on the person. Sometimes that's kind of even determined by height, weight, gender, and so on and so forth. So sometimes it just really depends on the protocol and the machine and so on and so forth. So if you're someone who's been hearing the buzz about TMS and, oh my gosh, yeah, no, I heard about that. I learned about that in school. My cousin just had that done. And you want to learn more about TMS, or you're like, oh, no. I've been thinking about this. I just really didn't know where to go. Please give us a call here at Augustin Psychiatric Associates. We would love to hear from you. We would love to talk to you about it. We would love to further educate you and answer any questions that you might have regarding transcranial magnetic stimulation here at Augustin Psychiatric Associates.